In this video, I will talk about 10 important questions every woman should ask their gynecologist after the age of 50. Stay tuned to learn much more. Welcome to Women's Healthcare Answers, and this is Jeffrey McQueary. I am a practicing gynecologist in Tennessee, and I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can with answers and solutions I will give you. Today, I want to talk about 10 important questions every woman should ask their gynecologist after the age of 50. This is a very important time of your life, different from any other, and I know you have these questions. So stay tuned till the end for a special bonus question and answer. Let's get started. Number 1. Do I need to do Kegels exercises, and how do I do them correctly? Kegels exercises are pelvic floor muscle exercises, and these are often not done well, and there's a lot of information on the internet about these exercises and how you can use them today. Weak muscles later in life can lead to urinary incontinence and pelvic organ prolapse, which I think we all think would be best to prevent. To do Kegels, imagine you are sitting on a marble and tightening your pelvic muscles as if you're lifting that marble. Try it 3 times in 3 seconds at a time. Then relax for a count of 10 and continue to do this, maybe even up to 10 times. It's really hard to do, and rarely do my patients do it well. It's typically just squeezing your butt cheeks together or something like that, and that really doesn't do anything. I did find that Mayo Clinic has a good explanation online of how to do these Kegels exercises if you need more description of it. If you don't think that you're doing them correctly or having a hard time doing them, you could be doing more harm than good. So visiting your physician or a pelvic floor physical therapist might be helpful. Number 2, why am I leaking urine when I cough, laugh, or sneeze? Extremely underreported problem that is common throughout various age groups, true of stress incontinence. It happens when physical movement or activity such as coughing, laughing, sneezing, running, or heavy lifting puts a lot of pressure or stress on your bladder, and this causes you to leak. Stress incontinence is not related to psychological stress. I had a patient that asked me that one time. Urinary accidents like this can range from just a few drops of urine to enough to soak through your clothes. There are multiple treatments that can help that may not even involve surgery, so talk with your gynecologist and they can guide you to the correct treatment. Number 3, why do I have a hard time making it to the bathroom on time? So the name for this is OAB, or overactive bladder, and it's defined as a strong urge to urinate produced by a bladder spasm that can cause, if severe, a sudden loss of urine. That would be urge incontinence if it gets that bad. About 40% of women in the United States live with these symptoms, and many people living with OAB don't really ask for help. They really feel very embarrassed, and it may affect your relationships with your friends and family. It can disrupt your sleep, leading to fatigue. This is one of the common things that I see. The easiest treatment options are to decrease fluids in the evenings, or if you're going out, that you can decrease them as well. But Kegels exercises can help, but even medications are a second line of therapy that can be very helpful. Don't be embarrassed and talk with your doctor about these kind of situations. Number 4, why do I feel pressure in my vagina and pelvis? Pelvic organ prolapse happens when muscles and tissues supporting the pelvic organs, such as the uterus, bladder, or rectum, become extremely weak. Often pressure is accompanied with a bulge in the vaginal area that can be the first sign of prolapse. Pressure against the walls of the vaginal area is what causes this discomfort. And this is very commonly associated with a history of childbirth, Even one vaginal birth or a C-section can still put you at risk. Also, it's associated with menopause, heavy lifting experience, and exercising a lot. But these pelvic floor disorders, which are urinary incontinence, bowel incontinence, and pelvic organ prolapse, affect 1 in 5 women in the United States. So common treatments include pessary, pelvic floor muscle therapy, which is Kegels, surgery to support the uterus, vagina, or even surgery to close the vaginal area. That's extreme, but appropriate treatments involves really your age, your health status, and where you are in life. So talk to your gynecologist, who may treat these problems, or they may send you to a specialist. Number 5, what can I do about vaginal dryness? So thinning of the vaginal walls after menopause is the most common reason for dryness. And this is due to lack of estrogen. So it's an estrogen deficiency that happens very slowly, affects the vaginal lubrication, and affects the elasticity or the stretchiness of the tissues. It can even make it very thin. Patients notice symptoms when they haven't been sexually active for a long time. Then they are intimate with a partner and find that sex is painful. Some women are affected by this more than others, but common side effects beyond dryness may include even urinary urgency, leakage, and increased risk for bladder infections. Often I have patients who did not get dryness treated because they are no longer sexually active. Well, just remember, this is a problem affecting your body, and vaginal estrogen therapy is safe. It can be very helpful in helping you through these things. Vaginal moisturizers also can help, but don't really solve the problem. Let your doctor know what is bothering you and get help. Number 6, how do I know if I'm starting menopause? So we'll go back and note that the average age for menopause is around 51. Certainly you can experience it late in life, even up to the 60s, or it can be very early, even in the 30s. But really the most common time period is from about 45 to 55 years, leading up to what is called the perimenopause. Possible symptoms may include irregular periods, as well as night sweats, fatigue, and mood changes. A full year without a period is technically menopause, but it can always be confirmed with laboratory testing that your gynecologist can do. So visit them and assess if you're actually in menopause. Number 7, am I going through menopause and my hormones are out of control? Can you help me? So, as with the last question, if you've went through menopause, you certainly have asked this question. You can feel totally out of balance, tired, disconnected, moody. It is very important that you talk to your gynecologist about hormone replacement therapy and the risk and benefits of that for you. I personally feel that hormones can be used safely and can get you back to feeling normal again. According to the North American Menopausal Society, for women aged younger than 60 years or who are within 10 years of menopausal onset and no contraindications, that means nothing that makes it bad for you, the benefit to risk ratio is definitely favorable for you to have treatment of these symptoms. And they also can prevent bone loss. Or put more clearly, the benefits outweigh the risk of hormone replacement therapy for women aged less than 60. The evidence after 60 says the risk may be a bit too high for heart disease, stroke, blood clots, and dementia, but certainly please talk to your doctor about these risks, and you need to know what the potential benefits and risks would be for you. Number 8, what is a urinary tract infection, and how do I know for sure that I have it? So a burning sensation when you void, as well as increasing urgency and frequency, may be the symptoms of a urinary tract or bladder infection. We call it the same thing. A urine odor may also be present. So certainly increase your fluid intake and take azo, which is pyridium. Those can help. But you still may need antibiotics. So often, bladder infections can be associated with even sex, and antibiotics can even be prescribed to prevent those reoccurring infections. But as you age, you have a definite problem with the potential for what we call chronic cystitis. In this case, you may need that preventive antibiotic therapy, but there's other medications that can be used. But I always tell my patients to use cranberry as well as D-mannose, and that's been very effective in trying to prevent bacteria from sticking to the bladder wall, and it can be used to combat these problems if they are reoccurring. Call your doctor if your UTI symptoms persist or they're pretty bad. If you like the content so far, hit the like button and subscribe so you won't miss any of my new medical videos coming out every week. Number 9, are douches needed or are they even safe to use? Well, douches used to be used as birth control in the 40s and 60s, but the vaginal discharge that you produce is your normal body douche, and this is your natural self-cleaning system. So using these types of products, which may contain vinegar, baking soda, and iodine, can actually wipe out all the good bacteria that keep the abnormal bacteria in check. You can actually cause an infection from the use of a douche because these normal bacteria can no longer protect you from the abnormal ones. Looking this up, there's even some evidence that you are twice as likely to develop ovarian cancer if you use a douche consistently. So I certainly don't and can't recommend that, but there are absolutely no health benefits to adopting its use. Number 10, should I be concerned about a bump on my vulva? I know you're conditioned to be alarmed if you find any bump down there. So this is the outside of the vaginal area, and that's called the vulva. There are normal reasons for this, such as shaving and having ingrown or infected hair. But it could also be a cyst or a pimple. Certainly other major issues such as genital warts and herpes can be a possibility. And even rarely precancer or cancerous changes. Certainly have this looked at by a gynecologist to determine if it is serious or not. So we're nearing the end. I promised you one more if you stayed. Thanks for staying. Here's your bonus. Bonus question. Is there a medical reason why my sex drive is so low, and how can I increase my sex drive? So many women bring this question to me because their husband is kind of pressuring them to ask. Their partner wants them to be exactly the way they were, but as we know, the pressures of life and changes in the body, this is not always the case. You all know this, but it can bother you too and make you wonder what is wrong with you. So the technical term for this is low libido. It can be a secondary to physical effects of falling estrogen, medications, diabetes, high blood pressure, depression, or even stress can actually cause some of these symptoms. So hormone replacement therapy, as we've talked about earlier, and lifestyle changes can help really enhance your sex life. But it's best to talk with your gynecologist. So I always say, take control. If even the suggestion by your partner of sex makes your stomach turn, then be intimate on your terms. Suggest the day of the week that is good for you both and have a date night that will end in intimacy. This will give your partner something to look forward to, and hopefully you won't feel pressured anymore. If this helps, you're welcome. If not, then just forget I recommended it. So this is a series of videos exploring a few of the right questions to ask your gynecologist. I hope you've enjoyed it because I've enjoyed being there with you. But please comment so I know what is bothering you and what problems are on your mind. I would love to help solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it is okay to reference the information I gave you.